It was developed out of the Shiatsu tradition, the Japanese massage tradition, and it's one that incorporates both Eastern principles of acupuncture, Western anatomical principles, and the main treatment techniques used involve either some degree of pressure, some degree of motion, or some combination thereof. Well, whenever some people's pain patterns involve long-lasting or chronic or relapsing conditions, and it seems to be very good at getting in the way of those and influencing the system to begin to repair itself where for some reason it wasn't or wasn't able to. So it seems to be very good for breaking up chronic pain patterns. But we've used it in all manner of conditions, from acute headaches to disc problems, tendinitis, all kinds of spinal problems. My teacher pioneered the techniques on folks with brain injuries and other more severe neurological problems. So it seems to fit in well with the naturopathic practice, especially the acupuncture tradition of naturopathy. And since pain is the #1 reason people come to see their doctors, it's good to have something that you can do to try and help people in pain. You don't expect people with problems in the joints or problems in the discs to heal as quickly as somebody with a problem in a tissue that has a higher regenerative capacity, like the muscle, let's say. A muscle injury should heal much faster, odds, all things being equal. So when we know a person's going to be battling something over a longer time frame, we tend to intervene more sparsely, once every 2 to 6 weeks, let's say, depending on the nature of the problem. If you know it's going to take months to years to resolve, there's no sense in bunching everything up in the short term. But then there are certain situations where a person's had, say, a stroke or a brain injury. You may do better to pile up a few treatments in the short going initially to try and take advantage of a window of time when more change is still possible.